There's no question that there's a lot of confusion surrounding liquid facelifts. Just the term, facelift liquid, what does it mean? It means that we use the bevy of different filling agents that we have, and also things like Botox, things that control muscle action in the face, and also things that we use to control wrinkles, are all lumped together so that when we use them in a certain balance, that we can create the illusion of lifting one's face. And the key word here is illusion, because there isn't anything that comes in a bottle or a syringe that will defy gravity. Gravity is what it is. It draws things down, and nothing that you inject can push it up. However, by minimizing wrinkles, by minimizing certain contours in the face, and that's what happens with aging. We have change in contours. We either lose volume in our face, or we have some gravitational changes that change the contours. So we're seeing shadows where we didn't have shadows before, all those sorts of things. And so when we have that, we can inject things that volumize, we can inject things that camouflage something that's dropped. And by doing so, we give the illusion of a lift. But I think that the manufacturing companies are at fault, I think that the media is at fault, and they all create an illusion that by injecting or using Botox, that we can actually affect a lift, something that goes against gravity. So when I think about how fillers have evolved over the last 10 years, it's from my standpoint, made it much more satisfying to use fillers. But there are specific fillers that you use in specific areas. You have to distinguish from when you're volumizing as opposed to when you're treating wrinkles of motion and all these different things. So it comes down to the assessment of the patient and seeing where do they need volumization, these contours that I'm seeing, what's causing them, and then look at the underlying cause and then choose the right combination of fillers and Botox for different areas that's going to give us the best result, and that's going to give us the illusion that we've actually lifted certain areas of a patient's face. There is no question that liquid facelift as a term is probably a good term, because we do create the illusion of a lift. But in reality, we're not lifting per se.